Thank you. Wow. Good evening. I'm very honored to be here, and thank you all for joining us in this public program. I want to start by thanking the School of Public Service, Dean Skip Rutherford. Thank you. And the staff and Dr. Williams from the Center of Community Philanthropy here in the Clinton School. It's been a great opportunity to join the efforts that the school are doing in community work. So, as previously introduced, I'm part of the faculty at the University of Puerto Rico School of Public Health, and I'm honored to spend several months here conducting research. And part of the presentation today, I will share a little bit of the background, but also some of the foundations that are informing the work that I'll be doing here for the next several months. I am Puerto Rican. I was born and raised in Puerto Rico, and I am a very proud Puerto Rican. And from that place, I would share my thoughts and the work that I do and will be doing while I'm here. So in the next 30 minutes or so, I will provide some context of what's happening in Puerto Rico, including the current sociopolitical climate. And I will also discuss the impact of Hurricane Maria and Hurricane Irma in the discussion that you've seen probably here in the United States. I don't want to see a show of hands, but I would like to know, or I invite you to think, how you knew about Puerto Rico. How much do you think you know about Puerto Rico? Well, I wouldn't be surprised if you don't know much about Puerto Rico, but I would share some thoughts, and then I would share data about how much the average US citizen know about Puerto Rico. Puerto Rico is an archipelago in the Caribbean Sea. We are nearly 1,100 miles from the coast of Florida. We are an organized but unincorporated territory of the US since 1898. However, in Puerto Rico, we lack self-determination. We Puerto Ricans in the island don't have full representation in Congress, and we cannot vote for president. So we cannot be blamed of what's going on now. Further, the US federal mandates that take precedence over local legislation and policies in Puerto Rico in all areas of governance, meaning that no matter what brilliant laws we can have in Puerto Rico, if it is not consistent with a federal law, we cannot have it. And you know, as I said, I'm not judging because it would not be surprising to you to know that most US citizens don't even know that we Puerto Ricans are fellow citizens. Actually, in a recent study conducted by the Pew Institute, it was documented that nearly half of all the adults in the US do not know that Puerto Ricans are fellow citizens. In fact, we are citizens by birth since 1917. By the way, that didn't happen just by chance. Around that time, the US was involved with World War I. So what happened was that they needed soldiers. So why not to get soldiers from the colonies? And then we became citizens. And we Puerto Ricans are everywhere, and I'm sure there's some Puerto Ricans here, right? Great. So yeah, everywhere. And here, basically, you can see some of the hotspots, as they call, for the migration patterns of Puerto Ricans to the United States. And most of the migration historically has been to the Northeast. It's a matter of, it's closer to Puerto Rico. Now, currently, the majority of the people leaving the island are going to Florida, but we're seeing other places getting people migrating. Also, that happened after the hurricane, and we can talk about that once we get there. But really, for most of the US citizens, the political and economical landscape of Puerto Rico looks distant and foreign. Nonetheless, we have been in the news and in the front lines, right? But let's set the record clear. Puerto Rico in English means rich port. That's a literal translation. But, you know, Puerto Rico is not rich. Puerto Rico is poor. It's actually very poor. In fact, when we compare Puerto Rico to Mississippi, which is the poorest of all the states of the United States, Puerto Rico has nearly double its poverty rate. In our island, more than half of the children live under poverty level, mostly coming from households in which parents are unemployed, and we have 15% too many poor children out of schools. Similarly, we have an ongoing housing crisis in Puerto Rico. Home prices in Puerto Rico are still going down, many of which are now abandoned after residents have left the property. And we have not bounced back, as you can experience here in the States. The States data is a blue line, and the white line is Puerto Rico. And not to mention the healthcare sector. As you can see in this image, Puerto Rico has a fixed matching rate for Medicaid financing versus a per capita income in the States. And we have a federal cap that was established in 1967 for expenditure in healthcare in Puerto Rico. Yes, you heard well. You heard right. A maximum expenditure cap that was established in 1967, and that has not been changed. So, if you have any doubt, let me clarify you. It's technically impossible to provide healthcare with an expenditure cap that was established in 1967. Not surprisingly, we've seen a significant reduction in the Puerto Rican population living in the island. We are projected to lose a significant portion of our residents in the next decade. The projections are gloomy. We might lose about 1 million residents between now and 2050. But all these negative social outcomes are not really new. The same laws that made Puerto Ricans U.S. citizens in 1917 also empowered the island to raise money on issuing tax-exempt bonds. That helped governments to accrue unmanageable debt, as investors have grown tax-adverse and eager to shelter income. It is true, since 1917, things have changed in Puerto Rico. But these changes have negatively affected the island by modifying the social condition under which we could plan or execute a sustainable plan for development. So it's true, Puerto Rico has a debt of over $100 billion in bonds and unpaid pensions that represent nearly 70% of the GDP. Not surprisingly, because our disadvantaged position in the context of the US policies, 20% of this debt is related to healthcare. What is very surprising is that the debt has never been audited. However, the current local government in Puerto Rico and the congressional powers are only implementing austerity measures so Puerto Rico pays the debt. And let's be honest, Puerto Rico cannot pay that debt. And our situation is not too different from those from several states. Yeah, it's true, our debt is higher per capita, as you can see in this graph, but it's similar to other states, including those states recently affected by natural disasters, like Texas, Florida, and Louisiana. In a more recent action of imperialistic dominance, in 2016, the US Congress passed and the President Obama signed a law to create PROMESA, or the Puerto Rico Oversight, Management, and Economic Stability Act. That law provides for a 7-person board, what we call the Fiscal Oversight and Management Board, to oversee Puerto Rico's finances. This board is not accountable to Puerto Rico's elected government and has control over the island budget, laws, financial plans, and regulations. And you know, it is a very powerful board. They have the unilateral power to change the political, economic, social, and environmental landscape of our islands. They have already engaged in discussions like reducing the minimum wage to $4.25 per hour and making strikes illegal. Do you still have any doubt that colonialism is the most powerful determinant of the well-being of Puerto Ricans? Well, let me share a little bit more. Let's talk about FEMA. Puerto Rico contributes to the annual appropriation of FEMA as any other state do. FEMA is like insurance, so it's not charity. Therefore, we rely on its response in case of emergencies. But in fact, the recent hurricanes exposed the colonial laws that limits the scope of actions that Puerto Rico has in response to emergencies. Bear with me, one more example. The Merchant Marine Act of 1920, or the Jones Act. This is the law that controls all the waters and ports of Puerto Rico. All the waters and ports of Puerto Rico are controlled by the US. This is the law, applies also to Hawaii, by the way, is the cause of having goods that are more expensive in Puerto Rico when compared to goods in the continental US. And as we will discuss later, also restrains our ability to have proper emergency response. For example, it's because of this law that we can have chips in Dominican Republic, which is just a few miles from Puerto Rico, but they cannot get to Puerto Rico if they don't have the permission of the US. Not surprisingly, as you can see in this graph, the Jones Act has a negative impact in the local economy. And it had terrible implications in the delivery of emergency and recovery supplies in the aftermath of the hurricanes. So indeed, what happened in Puerto Rico last September was a perfect storm. And I call it so because it's a combination of a natural disaster of major hurricanes and human-made financial crisis manufactured by banker and predatory class of investors. I hope that by now it is clear to you that under that economic and social circumstances, it was impossible for Puerto Rico, either individually or as government-wise, to respond properly in the aftermath of hurricanes. Maria, a Category 4 hurricane. Category 4 means winds that were over 140 miles per hour, and we got over 30 inches of rain within less than 24 hours. Maria made land in Puerto Rico in September 20th in the morning, I remember. But that happened just 2 weeks after Hurricane Irma impacted Puerto Rico and made significant damages to the electric grid, houses, and roads. I was in Puerto Rico for both hurricanes. I was in my apartment in San Juan when Maria hit the island. I was with my partner, I was with my mom, the people that mattered the most with me. I felt sheltered and safe, but I have to say that that feeling changed over time. It was a long hurricane. We spent the whole day under hurricane conditions. And at some point, I was not sure I would go through the hurricane without having to take extra safety measures. In the aftermath of Hurricane Maria, it was estimated that the death of 64 men and women and more than 900 allegedly caused by natural causes. The total destruction of the electric infrastructure, major interruptions in telecommunications, significant damages in highways and roads, and limited access to potable water and food. Most of the images that were rolling before we started, hopefully you got to see some, were images of Puerto Rico right after the impact of the hurricane. But you know, hurricanes, as many other disasters, don't affect us all in the same way. In this image, you can see a picture. This is Guaynabo. Guaynabo is a suburban area that is part of the San Juan metropolitan area. It's a relatively affluent neighborhood. Can you spot some tarps or blue roofs? Yeah, probably one here, right? But of course, this is the area of Caño Martín Peña. This is a port and disenfranchised community in San Juan. The blue roof are quite obvious, huh? In the aftermath of the hurricane, we had to deal with the mistreatment and politics while responding to a natural disaster in the context of our relationship with the United States and the current administration. While it was extremely difficult to establish communication with Puerto Rico, and many of the Puerto Ricans that were trying to reach family during the hurricane can testify about that, The message that was sent to the US and the rest of the world was that the response was okay, we were doing right. And I would like to share a video. It's very likely that in the aftermath of the hurricane, you heard a little bit from Ms. Carmen Yulín Cruz, the mayor of San Juan. So I want to share one of those memorable instances.
Listen to this.
I am very satisfied. I know it's a hard storm to recover from, but the amount of progress that's been made, and I really would appreciate any support that we get. I know it is really a good news story in terms of our ability to reach people and the limited number of deaths that have taken place in such a devastating hurricane.
Ed Mayor.
Well, maybe from where she's standing, it's a good news story. When you're drinking from a creek, it's not a good news story. When you don't have food for a baby, it's not a good news story. When you have to pull people down from their buildings, because I'm sorry, but that really upsets me and frustrates me. You know, I would ask her to come down here and visit the towns and then make a statement like that, which frankly, it is an irresponsible statement, and it contrasts with the statements of support that I have been getting since yesterday when I got that call from the White House. This is, damn it, this is not a good news story. This is a people are dying story. This is a life or death story. There's a truckload of stuff that cannot be taken to people's story. This is a story of a devastation that continues to worsen.
What's the status of Puerto Rico as of today? The facts are that as of today, 141 days after Hurricane Maria, we still have 500,000 residences without roof or with significant damages. 5 shelters are still open, housing 65 individuals and 4 pets. 25% of the locations to provide services under the food stamp program are closed, and without any certainty of when they're going to be open, if ever. Nearly 30% of the island has no electricity, and it has been estimated that it won't be entirely restored before May. By the way, my mom is one of those without power. And that's the story of many of the Puerto Ricans in the diaspora in many places, or in Puerto Rico out of the San Juan area. And you know, she got some hope 3 days ago, and I almost celebrated and posted on Facebook, you know, my mom has power. But, you know, just partially, just half of the house of power, because of course the system is all messed up. The reestablishment of the service is getting complicated, more bureaucratic, and even violent. And about FEMA, well, Mother Nature is keeping them busy, unfortunately. But on top of that, they have communicated that they're stopping sending new shipments to Puerto Rico because there is enough already in the island. Again, not surprisingly, people died and are dying in Puerto Rico due to the lack of electricity and basic goods. Officially, the government have confirmed 64 deaths caused by the hurricane within a month of the hurricane. However, if we analyze the demographic data, what we have in evidence, and I'm showing here, is that we had over 1,000 deaths more during the month between September and October than we had in any year before. So I don't know, but the only thing different that happened in Puerto Rico, besides everything else that I've shared, was a hurricane. So I think that can be correlated somehow with the amount of deaths that has been reported. And you know, I agree, recovery is being slow and unreliable. Here I am sharing data on the recovery of the electricity and cellular networks. The fact is that recovery system may exhibit unreliable performance during the recovery process. Recovered infrastructure might not achieve pre-disaster levels of performance after being formally declared to be recovered. And varying magnitudes of interdependency exist among different types of networks. And this is research that we are doing now in collaboration with engineers from Ohio University. And yes, Puerto Rico's crisis is not generally seen as a racial matter, but it should be. And in fact, this is part of the work that I'm going to be doing here with the Center on Community Philanthropy. So hopefully by the end of the semester, we'll have some data on the perception of race and the role of racism in the aftermath of the hurricane. Yes, racism is one of the main problems, but since the conception, the rationale that to acquire colonies after the Spanish-American War of 1898 rested on the notion of white racial supremacy. And the entire legal structure that defines Puerto Rico as an unincorporated territory, that means that is part of us, but not really part of us, is unapologetically racist. And yes, these are century-old set of laws. But let's take a quick look of what's going on right now. This is part of a letter sent, as you can see here, February 5th, 2018, just a few days ago, from Promesa, the board, to the governor of Puerto Rico. In this letter, they are demanding structural reforms that include, among other things, changing the labor market to reduce requirements for vacation and sick leave. Meaning no vacation and sick leave for any person who has a job in Puerto Rico. What's that? Yeah. Further, they have also asked for fiscal measures to reduce significantly the municipal subsidies, pensions, and even privatizing the prison system in Puerto Rico. In the meantime, many Puerto Ricans have to deal with having no electricity and not enough money to cover basic needs. I must agree with my colleague, the Puerto Rican scholar Frances Negron Montaner, that to succeed against the present and coming storms, people in Puerto Rico may require not only to better building materials, but also greater understanding of how racism takes many forms and is continuously resembling. And you know, Trump and his administration is responsible for the disaster undergoing in Puerto Rico, as well as all the other administration that preceded him. And yes, he threw paper towel in a country undergoing a humanitarian crisis. But we know that the recovery is not a success, nor that he is the sole responsible. The evidence is appalling, and it shows clearly how colonialism is the ultimate determinant for our well-being. And to conclude and have some time to talk and discuss, I want to share some lines from an editorial that I had the honor to publish in the American Journal of Public Health. And that editorial I wrote several weeks, probably 3 weeks after the hurricane. I was lucky enough to have family in Florida who said, come on here and take a little break of the island. So I went to Florida, and I needed to continue doing something. I was busy in Puerto Rico working with the community, doing many things that weren't necessary at that time, and I felt completely wrong in leaving Puerto Rico and having space, time, hot water to take a shower. So I decided, I'm going to do what I think I can do best, that is to share my thoughts and criticize and analyze from a very important critical, what I think is an important critical perspective, what's going on in Puerto Rico. So in the aftermath of the hurricane, we have witnessed solidarity and commitment to the restoration of our communities. I could share many examples of that, but I would like to highlight two that, to my understanding, best represent that. First, it's the community. The community-level actions were fundamental in restoring access to neighborhoods and ultimately saving lives. One major failure in the process was that it took so long for national and federal authorities to reach rural areas of Puerto Rico. When media were able to reach these areas, most of the images that we were getting were about people helping elders, getting drinking water, clearing debris from roads, and organizing shared cooking spaces. And secondly, the Puerto Rican diaspora. They have played a major role in the response of the natural disaster. During and after the hurricane, we witnessed Puerto Ricans not currently living in the island supporting and organizing aid for those in Puerto Rico. Social media became a place to share their hopes, frustrations, and readiness to assist. There are nearly 5 million Puerto Ricans not living in the islands. Just the distance did not curtail their commitment to Puerto Rico. I and many others are very thankful to the Puerto Rican diaspora for the pressures that they have exerted upon politicians and the national and international media. Their interventions made the humanitarian crisis in Puerto Rico visible, helped in the emergency response, and sustained public discussion. And, support came from everywhere, including Arkansas, where I am happy to know that you have a vibrant Puerto Rican community. Thank you. And finally, thank you all for the interest in this discussion. Puerto Rico has not been destroyed. We might not have electricity, but we have power. Thank you.
Carlos, thank you. Well, Puerto Rico, up close and personal, and particularly from someone that lived through it. So, may I throw it open to questions? Oh, hi, Susan. Yeah, right here.
You reviewed the debt crisis. Do you have any suggestions as to how that can be ameliorated in Congress? Or how we might start making progress?
Well, the debt should be condoned, and we should have reparations in Puerto Rico for everything that had happened in so many years. That might respond to the second part of your question. What can we do in Congress? Well, that's why I appreciate so much the work of the diaspora and of those Puerto Ricans that are now relocating in states where they can, just because of moving and getting a new address, have the power to vote and have representation. We don't have that. We don't have representation in Congress. We don't have votes. So the only thing that we can do is to claim, advocate, inform, work with allies, and I think that work has been done, but it's very difficult with so many issues going on. My encouragement is to continue the discussion, getting to inform others of the current situation of Puerto Rico, because with the power that brings the vote and the influence that we can make in the discussions, either at the local or the national level, I believe is the best shot that we have right now.
Did FEMA reverse its position and start sending more supplies?
So no, they haven't. So they clarified that what they meant was that they have shipped enough, and there are things in Puerto Rico that has not been distributed yet.
Okay.
However, nobody knows where those things are.
Got it. Okay. Any other questions? Yes. Back here.
Speaking of FEMA, I believe I read in the paper a couple of days ago that they've made a decision to completely pull out of Puerto Rico. Is that correct, and why?
So they sent a letter, I think it was Monday or Tuesday this week, saying that they were pulling out, but then they clarified that what they meant was that they were not shipping anything to Puerto Rico because we had enough in storage. But unfortunately, the local government don't know where those resources are. So it's either a really bad case of miscommunication between the local authorities and the federal government, or somebody's lying.
Yes, sir. The microphone's coming right at you.
Thank you. A great presentation.
Thank you.
I retired from the state of Arkansas and decided I wanted to reach out and do something for community service, so I am now employed as a reservist for FEMA. My first deployment was Puerto Rico. So I spent 30 days in Puerto Rico from October till just before Thanksgiving. So recognize a lot of the pictures you took there. I also have some perspective of how it worked on the ground from,
Please
I
share.
can't speak for FEMA as an agency, but as a FEMA employee, I got to see and work with a lot of the Puerto Rican government officials, with a lot of Puerto Rico citizens. One of the things, our greatest problem as just a worker on the ground, I work in Vega Baja and worked up in Orizaba, Manatee, Florida, those areas like that. One of our biggest problems was communicating with local, down there they call them municipalities, and they have a mayor. And I'll use an example about the food shipments to Puerto Rico. At the time I was there, things were beginning to settle down and stores were beginning to reopen. And there was interest among, not all of them, certainly not island-wide, but in the Vega Baja area and Manatee and those areas like that, which is kind of north-central Puerto Rico. They were interested in transitioning from response to recovery, which means they wanted to get their economy back up and going. They wanted people going to the grocery store and buying things rather than depending on FEMA to deliver food and then they'd go get it. It was free. So we would take our information, or they would come to us and say, okay, we are wanting to ramp down or lessen the food shipments to a certain municipality. And so it was often hard to tell who needed the food and water and who didn't need to. And I'm thinking maybe some of this confusion that you're hearing about, they're cutting off food supplies, is just the local economy and the local government wanting to start their economy back and go into the grocery store. Now, I know that was a very common situation where we'd get a mayor from a municipality say, I want water, because PRASA, which is Puerto Rican Water Authority,
Water system, yeah.
They were still struggling to get up and going. So they still needed lots of water, but they were wanting to cut back on food shipments. And we had an abundance a lot of times in the storage areas, and they called them pods, points of distribution, distributed around the island. And they would be backlogged with food, but not with water. So we'd get a lot of requests for water, but not so much for food. So again, just kind of a perspective. There was a lot of trouble communicating with local governments. The other thing that we had a big problem with in the FEMA response is that FEMA works on a very structured process of how they manage a disaster. And in Puerto Rico, I worked on the side. My job was that the first 30 days of the disaster, it was so overwhelming that FEMA was pushing supplies into the island without any backtracking of where they went, who got them, and those sorts of things. And I worked with the Corps of Engineers on establishing sites for generators. And so my job was, I got a list of all the sites that were supposed to receive a generator for reestablishing water through PRASA. And I went and decided, yes, there was a generator there, it was running, and it's being fueled.
I don't mean to cut you off, but we're trying to get some people to ask questions.
I'm sorry.
So I think your story's important, but I would encourage you to come talk to him at the.
Okay.
So, do you have a question?
No.
But I would like to make a
The simple
comment.
point was that it was an overwhelming disaster that FEMA was unprepared for, and we had 20,000 people there. 2,000 of them were FEMA employees. So most of them were not in FEMA and were not used to working, a disaster of that nature. So anyway, I just want to say from the perspective of being on the ground, what it looked like.
No, and thank you for your comment, and thank you for your service. I would like to make two comments. One is I can see how the local government might have felt the pressure to try to have the economy back as soon as possible, because let's get back to Promesa. We need to generate taxes so we can pay or reorganize and redistribute the way that we are now being asked to do. That is not necessarily consistent with how we would do things under normal circumstances. I'm not saying that as a justification, but I can see that happening. And the other thing, you mentioned something that is very interesting, and I've heard from other people in the federal government, that there is a very structured system on how to do certain things, but then you are trying to put a circle on a square because you had a different kind of situation, but not you, but the system was trying to do exactly the same thing and following the same procedures that were not working. So we didn't realize that we're not working until probably late December, when they said, listen, we need to be more flexible on this or that. So I think that also speaks of things that we can learn from this experience to change systems that we need to have in place and that should be ready to respond to different kind of disasters. Again, thank you for your thoughts and the work you did here, there in Puerto Rico.
Well, I go back. I enjoy working with Puerto Rican people. They're very dynamic.
Aren't we fun, huh? Yeah, even in the disaster, the level of enthusiasm, commitment, and it was something different. And I thank you for sharing. Thank you for the work you did in our country. Thank
Any other questions? Yes.
It seemed like doctors were leaving the island because of the lack of Medicaid funding, even before the hurricanes hit. Has that worsened any?
That's another talk. But yeah. Yeah, so we had, some have called it a brain migration, basically talented, well-educated young professionals leaving. One of those groups were physicians. They were leaving Puerto Rico in part because of the wages, as their salaries are lower, and they are licensed and board certified as any other doctor in the United States, so they could get a license in any other state relatively easy because they have the competencies and the education. So that was one thing. And then the system is working in a way that is not allowing physicians and clinicians to do their job the best way they could, because they have to respond to a system that is basically capitation and with very limited resources. So even when a physician, for example, wants to prescribe certain medication, if the PBM or the medications selected to be covered by certain medical insurance does not include that medication, then they override the physician. And they have the right to do that. But that's very unfortunate, because that kind of decision is made on economic basis, not on the well-being of the patients, nor the best possible healthcare provision.
Yes, sir. We have a question right back there.
Well, for a long time, Puerto Rican bonds were given the state tax exemption, like here in Arkansas. If you got an Arkansas bond municipal fund, it would include Arkansas municipal bonds, and that would also include Puerto Rican bonds for diversification. And so Puerto Rico had this ability to get tax-exempt financing in any of the 50 states. Was that a help, or was that part of the problem?
Well, both. Initially helped, but when we mismanaged, became a problem. So we basically engaged in too many loans that were not payable. And then that continued to decrease our ability to get loans, to the point that since 2015, we cannot get loans.
Carlos, the former presidents, Carter, Bush, Clinton, Bush, and Obama, all had a big fundraising effort for disaster relief, for Florida, for Texas, and for you. What happened? Do we know what happened to the money? Do we know? Do you know? Have you any idea where it went?
Yeah. So, unfortunately, yes. First of all, I mean, the former presidents did fundraising, and I'm assuming that money has already been given to Puerto Rico. I don't know. What happened was that the government of Puerto Rico created a non-for-profit that was called Unidos for Puerto Rico, or United for Puerto Rico, to kind of channel all the donations. But if you look at the board of directors of that foundation, it's very sketchy. Like the First Lady is involved, and then big businesses in Puerto Rico are involved. The former director for communications of the current governor's campaign is involved. So there is a lot of skepticism about that organization and how they've been using the resources. Just to give you an example that I came to the light yesterday, the irony came to the light, right? The irony gets worse because the First Lady just sent to municipalities, the First Lady of Puerto Rico, she sent candles to the municipalities made by local artisans in many people felt very offended because it's like, are you using money to send us candles? And very well decorated, like very fancy looking candles. It's like, we don't have electricity and you're sending us fancy candles that smell like coconut, by the way. And the First Lady was all offended because she said, this is just a token of hope. And people were responding like, yeah, we're past hope, right? We are past hope. We need action. So, and unfortunately, funding for that kind of actions have been coming from that entity. So I got questions about where to donate since very early in the process. I said, go straight to the community. So I had power, electricity in my apartment because we had a generator. So I worked very closely to a community-based organization, and we basically established work from my apartment, and we set up a website so people could donate, and we turned that money into goods. So we were doing outreach with the money that people were donating. And that's just one example. There were many and quite few organizations that were getting the funding and the resources directly, and they were accountable, and they've been providing information of what they've done with the resources that were provided. As of today, I don't know what had happened with the Unidos por Puerto Rico.
Okay. We had someone who has a question. Does someone have a question back there? The back. Okay, here's a question right here.
Hi, I'm a Clinton student. My roommate here, actually, her family is in Puerto Rico, so we're here, and thank you for speaking to it. We're in global development right now, and we're covering colonialism. I wish my teacher was here because you basically said a lot of the stuff we talk about. And a question was posed today in class about how to right the wrongs that the United States have done for countries with colonialism. And the question was posed today, is it right to do aid, or would it be best to leave these countries alone and let them recover on their own? And so I know there's obvious and immediate need to help people in Puerto Rico right now with the hurricane. But I'm curious to know how you'd answer that question in regards to Puerto Rico. Like, once we are able, hopefully, to help continue to help people with that are victims of the hurricane, what's next for Puerto Rico and the relationship with the United States?
So I will share a fact and then my opinion. The fact is that we expect and we should expect support and aid because through FEMA we contribute for FEMA to exist. So we should expect FEMA to do the work that they have done and better, right? And that's one thing. I believe in reparations. I believe that post-colonial or current colonies in the future should have the right to choose how to evolve from that colonial relationship, and should be the constituents of that country who choose how to move to the next step, with, of course, the reparations from the empires. Of course, the story of Puerto Rico is a little bit more complicated. I have just concentrated my discussion on the relationship with the U.S., but before being a U.S. colony, we were a Spanish colony. So there's a little bit more of history that we had to add in the discussion of how to move forward.
Yes, sir. You got a question right here, then we'll get to you. Here comes the microphone right behind you, so we can record it.
If Puerto Rico were the 51st state, do you think the response would have been better? And do you think this experience might hurt or hinder any movement towards statehood?
No, I don't think it would have been better. Not now.
Okay. Yes, I hear.
I'm a medical educator, so my first thought was is there any plans, or is there, I would expect some sort of activity towards projections on the effect of the natural disaster and the inadequate response on infant and maternal mortality and morbidity and overall life expectancy for the population as a result of this catastrophe?
Great question. Actually, there is even research already going on. One of the big challenges that we had is to monitor data because, of course, after the hurricane, all the systems were down, and then that was not a priority, unfortunately. But we're trying to restore that. There is research going on in terms of from even environmental exposure and risk to premature birth and the impact that it has in life expectancy. Some of my colleagues at the School of Public Health are leading those efforts. Yeah.
Listen, there are more questions, so I'm going to let you come up and visit with Carlos as we conclude. But I want to say that one of the great things that happens here at the Clinton School is the work of our Center on Community Philanthropy that he referred to. And of the many great things that the center does, one of the greatest is the scholars and residents that it brings to the campus so that our students, faculty, and staff can be educated, enriched, and inspired. And that wouldn't happen without the leadership of Dr. Charlotte Llewellyn Williams here. So please give her a hand. And I must say that having Carlos here already just a very short period of time, he's made a huge difference in this school. And I look forward to his work. I think it's a fascinating topic. And Carlos, thank you for being with us.
Thank you.
And thank you all for coming tonight.